Oh, Louie?
Yeah. A chronic alcoholic? Go figure.
Don't you say nothing.
Could you get Lupe to call him a ride? I need to check on Louie.
I want to reach through that screen.
What's going on, everybody? Welcome back to the channel. Tonight, we are taking on episode 6 of The Pitt, season 2, 12 p.m. I'm Dr. Todd, by the way.
I'm Allycia.
And thank you so much for being here. For those of you who keep coming back week after week, we really appreciate it. This has been a lot of fun. We hope you're having fun with us. Like, subscribe, comment. We have a lot of fun interacting with you guys. If you are new here, I don't think I mentioned it, but I am an internal medicine doctor, trained in the hospital, work outside the hospital these days. Thoughts?
I'm a little worried about what we're going to see in this episode.
Did you bring tissues?
Did not.
I think you're going to be in trouble. All right. You ready?
Yeah. No.
No.
Yes. Let's get it.
You know, I used to say that. You used to like make that.
I know. Now it's a thing.
Let's go. Get some. We got to start out with Louie.
I don't know. I think they have to, right?
Okay. Holding compressions.
Good square line on the inside of CO2.
Charge you 200?
You can shock me, Fib.
Clear!
Stand by with Epi.
Epi, like EpiPen?
Epinephrine.
Oh.
Yeah. Different dose, but
Oh, why?
Sorry. Pass right through the cords. Good breath sounds inside
so
of...
that's due to esophageal variceal bleeding, more than likely, or upper GI. Well, that's pretty much what esophageal varices is, but
Asystole. Push the Epi.
asystole is not a shockable rhythm.
Oh.
Patients with lunch trays have been admitted.
Do you like how they went to someone drinking red juice after that?
Yeah.
I've been waiting for an hour. When am I going to see a fucking doctor?
No,
Oh, gosh.
not like that. You won't.
Aggressive behavior toward healthcare workers is a felony.
Is it a felony? Well, I mean,
Battery
Yeah.
of any kind.
Yeah.
would
I
be-
was just asking.
you were
But
not
patients
just
today.
asking.
Patients first. To be happy is still waiting.
You go, Dana. Poor girl
TMC
doesn't
charge
even.
nurse.
First day.
Hold compressions. Asystole.
Oh, Louie.
Pulmonary hemorrhage from liver failure. Is he going to make it?
A pulmonary hemorrhage?
From liver failure, she said.
Should we give PCC? Too late for that.
Yeah.
Then he's not an ECMO candidate. Nothing else we can do.
Okay, yeah. So the bleeding was coming from the endotracheal tube, which is in the airway. Okay.
No, I think we're done. Should we do a debrief?
Into the VR room.
Yeah. Anybody that wants to pay their respects can join us in there.
Let's just start it with something sad.
Yeah.
Why do I need to see a psychiatrist? Jada, why do I need to see a psychiatrist?
He's awake. He wasn't awake before, was he?
This is the first time we're seeing him awake.
Okay.
They mentioned last episode that he was.
I was trying to study, but then they wouldn't stop talking.
Who wouldn't stop talking?
They don't want me to pass the bar.
Is he schizophrenic?
It's looking like that.
Let's give them some privacy. Dr. Jefferson will let us know when he's done.
Thank you.
You could see it on all the health workers' faces, though. It's like they knew.
Talking about Louie or?
No.
Oh,
Jackson.
yeah.
Patay? Pulmonary hemorrhage.
I'm going to have to maybe look into this a little bit more, but the whole thing with pulmonary hemorrhage, so liver disease does, one of the consequences of which is an increased risk of bleeding. Liver disease causes you to not produce as much coagulation factors or clotting factors, so you're more risk to bleed then. Also, platelets get disrupted because the liver is responsible for producing something called thrombopoietin, which basically tells the bone marrow to produce platelets. And so you get platelet dysfunctions. And so bleeding is a risk. You know, a pulmonary hemorrhage to me seems like a pretty uncommon complication of liver disease. Esophageal variceal bleeding, which would be a much more common complication. So I'll have to look into the incidence on that because I don't know that I ever personally saw a pulmonary hemorrhage from liver disease, but obviously bleeding risk is heightened.
I can't get off the bed, Pam. Well, that's what I'm here for.
See, thank God for nurses like this.
Yeah.
How long have you been married?
Almost 20 years.
Well, just like us.
Care for people day after day.
Go home at the end of every shift, leave us all behind, and escape to Love Island.
Escape to what?
Love Island. Keep forgetting to turn on the subtitles.
I know.
This is a very low subdissociative dose of ketamine.
Ketamine. I've heard of that.
Yeah, it's what what's his name from Friends ended up dying from overdose of.
Ketamine. Okay. So it's a painkiller.
It does a lot, actually. Helps with anxiety, helps with pain.
Here, I'm headed that way. Thank you.
Oh, I remember that nurse. We've seen her in a while. She's the one
I
that
don't
had the hots for Whitaker.
Oh, yeah.
Pulmonary hemorrhage. Didn't make it.
This pulmonary hemorrhage is going to bother you, isn't it?
Me?
Yeah.
Just
I want to
think,
look up the incidents, I know.
I just think Louie dying bothers me.
I know.
What about psychosocial causes?
Psychosocial.
Could be an intentional hunger strike
Oh.
Yeah, like
or refusing food to get to the infirmary.
Could also
Yeah.
be abuse or neglect.
Oh, okay, I see.
Say he's good to go. Let's get the ball rolling on discharge.
Let's wait on the CT results.
Oh, Louie?
Yeah.
A chronic alcoholic? Go figure.
Don't you say nothing.
Could you get Lupe to call him a ride? I need to check on Louie.
I want to reach through that screen.
Actually, Whitaker,
He croaked
What?
5 minutes ago.
Oh my God. Why is he so callous? Yes.
he really.
What she said.
I know.
Louie ever mention anything about a wife and kids?
As far as I know, he only had eyes for Rita Moreno.
For who?
I don't know
Oh,
who that is.
I don't either.
Yeah, there's a number listed.
You're his primary. Do you want to?
He's his primary. Oh, like he was the doctor on
Yeah.
chart. Yeah.
PTMC charge nurse.
Is this the code black?
Langdon, where are you?
His emergency
Oh, that is so horrible.
It's like they were his only family.
I know.
Friends upstairs sent donuts. Special thank you for working the holiday.
You gotta
Donuts.
be kidding me.
What were we expecting? Tacos and tequila?
Sure you want to go into this line of work?
I'm gonna get you one.
Of course I do, but I'm not taking admin's blood pastries.
Dana spitting facts
Admin's blood pastries.
instead of like blood diamonds.
Viva Knievel.
Brandon Lee, 52, fell off a motorcycle pyramid at 25 miles per hour.
You're just gonna keep bringing in the motorcycles.
Yep.
I'm fine. I don't need all this.
Were you wearing a helmet?
Of course.
Oh, what do you know? They're still in style.
Clearly, this was gonna be something that's a joke through the whole season. I mean, not a joke.
Shift.
Like, even when it's not your fault, sometimes it's worse knowing that there was nothing you could do.
Sometimes it's worse knowing there was nothing you could do.
Well, maybe just saying like
Oh, I mean, I thought
because
that was,
because you're truly helpless at
yeah,
that point.
I know.
But I don't know that. I mean, it's hard either way. To me, it's worse if you could have done something and you didn't.
Yeah.
Leave the ET tube in for the coroner, but Louie's a chronic alcoholic with end-stage liver disease, not a coroner's case.
Might be worth talking about like coroner's cases, what that
Yeah.
means. So I wrote that down to talk about at the end.
Okay. Now we roll him.
Oh my God, is he still alive?
No.
No, that's just air exhaling.
That is horrible.
I should say forced exhalation.
Yeah, that was. She should have warned her of that. I mean, I knew she wouldn't.
Oh, Royal Enfield ankle breaker, thumper. They call it an ankle breaker because you got to kick over a big fat single cylinder to get it started. Sometimes 5 or 6 kicks.
Robbie knows his motorcycle.
Yeah, he does.
That just leaves E. Joy.
Can I buy another vowel?
Dr. Whitaker. Exposure.
Oh, she's funny.
So the two med students, Joy, awesome. Ogilvy, not awesome.
No.
Hey, you think I could get something to eat?
I bet he's having food withheld from him.
Yeah.
But it will be a few weeks.
Before I can eat?
Solid foods, yes. Or you can have food pureed with liquid in a blender.
I don't have a blender.
He'd have to stay in the hospital, wouldn't he?
Probably not.
Cereals, fruits, or vegetables?
Not many fruits and vegetables in prison.
Rescued her from a motor graveyard and brought her back to life with a buddy of mine who's supposed to be coming in today.
Is that Abbott, maybe? A buddy of his is supposed to be coming in today.
Oh, okay.
Are you still coming over tonight? I think Whitaker is going to be playing Farm Boy again this weekend, so he's not
Are
going to
they
I
dating?
may need a rain check.
Is that?
Where-
I'm not good with the names.
where have
I
you
didn't
been?
missed it. I missed it.
Yes.
One of my uncles drank himself to death. Barely recognized him at the end. At least Louie always seemed happy.
No, not fighting in here. Still anyone's lunch, it's a $20 fine.
$20 fine.
Got more patience, not as fast as you used to be. Damn donut.
What is that? It's a donut.
First day back, I get kicked in the nuts.
You guys have a mannequin like that in your office, right? It's just a skeleton.
Oh,
Nurses are always decorating it.
yeah. We decorate it for the seasons. It used to be a person, but it was waiting for their prior authorization to be approved. Joke.
I was really selfish. I lied to myself and I lied to you. I'm really
You
sorry.
could check me off your list, kid.
Oh,
Got a lovely patient for you, too. Let's get you back on the horse.
she don't mess around.
Great name. What brings you in, Rocky?
No, don't.
Sick.
When did it start?
An hour ago.
After he won a hot dog eating contest.
Can they pull in the med student?
Oh, he won a hot dog eating contest.
351 hot dogs? No. 36.
Still a whole lot of hot
Full
dogs.
data Zofran.
Go for it.
All right, this should help. Stick it under your tongue, let it dissolve.
I would have
Okay.
given him that
You
through
take
the
it.
IV.
No.
Where's Ogilvy when you need him?
I know.
Yeah, I was going to say, I probably would have done that through an IV.
Yeah.
Too many carbs, not enough fruits or vegetables. He's lucky he hasn't developed a chronic illness.
She's showing a different side to her. That's
Why don't I
interesting.
call the prison doctor and find out what they're working with over
Yeah.
there?
Yeah, I think that's fair. I mean, this is one where I side with her.
Yeah.
Sometimes you admit people because you need to help them socially. Although not to nitpick too much, but she said too many carbs, not enough fruits and vegetables. Fruits and vegetables are carbs. Probably meaning too many
Yeah.
like hollow carbs, right? Like low index, or I'm sorry, like high glycemic index foods rather than,
Like you said, the wheat or tea and toast diet.
yeah, like complex carbs being fruits and vegetables that you need.
What do you say, kid? Ready to go home?
How's your pain, Mrs. Himmler?
He's not hurting her.
I don't think so.
Okay.
Yeah, no problem. I won't leave her side.
Oh, you need a break.
Oh, that's what it was. She won't stay in the hospital.
Now let's go home and forget this day ever happened.
I'll call the transfer ambulance.
Thanks, Princess.
She knows she's gonna pass.
You go ahead.
What?
Yeah, you can get the house ready. I'll be right behind you.
I bet she does.
Yeah, I'll stay with her.
You sure?
I wonder if she like doesn't want to die at home with her kids or something.
That's fairly atypical, though. I think
She's young though.
I know, but most people want to die at home.
She's thinking about other people.
Yeah, sparing them the imagery.
I even ordered the test. He's one Eliquis.
Mr. Francis comes in every month and always asks for a D-dimer.
D-dimer.
So let's talk about that D-dimer.
Okay.
That's a good one. Better for the end because it's going to be a little bit more thorough.
She don't like the sandwich. Maybe they don't have good
I
sandwiches.
think you're the only one who liked those.
The sandwiches were good.
She has a headache.
Okay, what else?
Notice though how Santos is keeping
I
eyes
did
locked
notice
on
that.
the patient
Yeah.
while the patient is
I
signing.
need to ask a million questions and I can't do it this way, so
That
just
is-
call me when IT comes down.
What you're supposed to do.
Oh, I would have never thought about that. Having to go into a hospital
Yeah.
and needing that interpreter.
What I don't know is why they couldn't maybe allow her to write.
Oh.
I mean, I might be off base here, but I mean, obviously she can communicate through writing.
Yeah,
We
and she
communi-
speaks English.
We communicate with people all the time in the hospital who are incapacitated or don't have an ability to speak, like when they're intubated, but we allow them to write. And so, like, I remember when I worked in fast food, when I was a teenager, we had a deaf patient that came in all the time. And when she would come in, she would come up to the front, she would ask for, a piece of paper, and she would, basically do that, which, it's easy kind of to tell what she wants. Of course, after a while, you get to know her. And then, so I would keep paper and pen up by the front. And so then when she would come in, and then, you would pass it back and forth. Like,
Yeah.
do you want onions on that? Do you want, and so.
We had, at the salon, we had a patient, or oh my God, not a patient, a client that would
Yeah.
come in for a perm, but she was Asian and didn't speak English very well. So the interpretation was like, it was hard. She would write, but it was very hard, and she would get very frustrated
Yeah.
with us. And we felt so bad, but like, we would try really hard
Yeah,
to
I know.
communicate.
It's difficult. But it just goes to show you, like, when you don't speak maybe the same language, and obviously sign language is another example of a language, but when you don't speak the language that the care team speaks primarily, it could be extremely scary. You know, even when you speak, say, English, a lot of what's being told to you is so complicated that
it's definitely
it's
not
really
English.
hard for most people to understand. And so obviously you can imagine that could be pretty scary.
Yeah.
But anyway, it's just a thought. I don't know
It's interesting.
what the technical answer to that is.
Mm-hmm.
Concerned about that, Neelix?
We could try a fluorescein injection. We'll need a wood slam.
Who is
Sterile ceiling, sterile basin, sterile
Is that
floor
that girl?
strip,
That's that nurse.
18 and 27 gauge needles, 5 and 6.
Why does she look so much more
I
like...
don't sure know all
Like
that.
boss.
Yeah.
She just does.
I don't know.
This is interesting.
Much better.
He said 8 mgs of ondansetron.
Any pain in the belly?
Do an IV. Ondansetron is Zofran. That's what he said. Give him ondansetron.
Then up to wet your whistle. So, how'd you get your start as a competitive eater?
Oh, no.
Poor guy.
I'm going to start feeling sick tonight.
What?
Just seeing it. Like, sympathy illness. What are they doing?
Fluorescein.
That is 250 cc's of sterile saline with one small touch of a sterile floor strip. Going to inject this fluid into your knee, Brandon. And if there's anything glowing in your wound...
This is kind of like the fight bite.
Okay, did they do that for the fight bite?
Not fluorescein, but they did do like an injection.
Oh.
That looks good. Laceration did not enter into the joint space.
Surgery not needed.
Well, so I got a rash with amoxicillin when I was 2.
Yeah, probably not a true allergy. Go ahead and give it, Kim.
People who think they have a penicillin allergy actually don't.
That is
To
true.
the nurses. They run the ER. We just try to stay out
That
of
is
their
also
way.
true.
Oh.
Now we can really clean him up.
Laugh and cry.
I know.
Once he's spotless, we'll tuck him in nice and tight, but we always leave one arm outside the sheet.
Because
They hold their hand.
So loved ones can hold their hand.
I really appreciate how they're walking you through this.
Like everything.
Yeah.
Like preparing the body and...
Because these are the things that nobody really maybe even thinks about.
And you want to stick around a little bit? Westbridge is close to internal disaster. We're getting all their runs.
Yeah, I heard. I put $20 on a plumbing issue. Poop Cruise documentary. Oh my God.
Poop Cruise.
That sounds like something I'll absolutely never watch.
Dr. Robbie.
I know. I don't think I can watch it either.
Especially not before we go on a cruise.
No.
There was no history of appendectomy.
It was in your note.
I may have forgotten to proof check it. I was using the app that Dr. Allycia suggested to catch up on my charting.
Wonderful. Dr. Santos was just using your AI tool for her charting, and it hallucinated a history of appendicitis.
Generative AI is not perfect. We still need to proofread every chart it creates.
Yeah.
Yeah, I don't really give a shit whether or not you want to use robots down here. Need accurate information in the medical record.
Understood.
Like you actually read the note.
Dr. Santos!
Yep, won't happen again.
I need accurate information. Well, I mean, she does, but...
You do.
Thanks, Prilla.
Drink this.
6 hours to go.
Energy.
You got this.
Wonder how healthy that is.
Bring the edges together. A lot of meat to close. Well, what would happen if we just did a simple wound closure?
But I kind of want to see what he says next.
Who?
Ogilvy.
Ogilvy?
No, I don't like him, though.
Donnie is the master of wound closure.
I do at least 10 lakhs a day out at triage, so.
Can we see your sub-Q?
Uh-huh.
You my guest?
If you insist.
Okay. Interesting. What are they doing here? They want us to like him now?
No.
Okay.
Is to be sure your entry point and exit point on both sides of the wound matches the depth on the other side.
What is this?
Start deep at the dermis.
Big bites help the tissue close.
You weren't very good at this.
Suturing? Oh, I was awesome at this.
Your card table didn't say so.
Those were practice knots.
Not 4.
Yeah, that's beautiful.
Yeah.
No,
look at
it's
that.
not.
Can use 2 more sub-Qs. 1 above, 1 below.
Okay. This is like before he's going to stitch it up.
Interesting ink. Do they mean anything?
This is death and chaos, and this is miracles and blessings.
Huh.
This one after the Pitt Fest shooting. And I got this after my daughter was born.
Oh.
The duality.
Yeah.
Life and death.
All my closest friends left after COVID. Had to do what was best for their mental health. A lot of people broke.
Yeah, all the world broke.
Why do you keep coming back?
Used to finish up here and then go help Perla for a bit.
Oh, she found a spot.
NPA coverage, giving everything that we need, and they've got an RN for overnights.
Even so, he's here because they're ignoring his basic needs.
What you're trying to do is very noble. We don't have the resources to spare.
This is interesting.
You're not admitting him because this is not about social justice.
Everything I've done in my career is an effort to improve the system. Just because you know it's broken doesn't mean you stop trying.
Oh.
I feel that. She feels that too.
Yeah, that's weird that he's like the administrator right now.
I don't think that. I don't think it's
know.
quite that.
He can't leave. I could take us weeks to figure out what's wrong with him.
What's wrong with him?
I'm so sorry. I did not mean it like that. Why don't we go somewhere quiet?
What's wrong with him?
Oh. Did she say anything wrong, you think? Or it was just a delivery, maybe?
Maybe the choice of words, I guess.
Yeah.
I think I saw her smile.
A true social smile. It doesn't happen until 6 weeks or older.
Buzzkill. But she's right.
But some parents have reported their baby smiled socially as early as 4 weeks. So, who knows?
That's a very well-behaved baby.
BP's 115/82, oxygen sats 95%.
You from Pittsburgh?
Yes, ma'am. Born and raised.
You know Sonny's Tower?
Worked there through high school.
No kidding.
You know Sonny's?
I first kissed there.
Hey, Stoney, my buddy Duke hasn't checked in yet?
No, I told Lupe to keep an eye out.
Thank you.
Yep.
Oh, so it's not Abbott. He
Oh,
said
okay.
my buddy Duke.
Back to check our work.
Nope. I need a silastic loop drain. That looks great.
It's thanks to your fine instruction.
Yeah, he's gonna need...
Must be fun to work here.
Are you guys liking the pit?
I feel like I was born to do this.
Hard cat. I'm shooting for pathology.
There you go.
Oh.
I like medical mysteries, but I don't really deal well with people.
That makes sense why she said that she doesn't want to be around death.
Yes.
Go into pathology.
And back down to the palm.
Needs to be smaller. I can't ride with a splint.
You're not gonna ride.
Riding at all. Right now, that's a non-displaced fracture. If you fall on it again, you're gonna need to go to the OR.
No worries, Doc. I won't fall again.
Oh, gosh.
Yep, that's famous last words.
Pulse ox just dropped.
What happened?
I don't know. I stepped out for a minute.
You having some trouble breathing?
A little.
He's gonna have to stay.
For how long?
Not sure.
Did she do something? She did. She sure did.
You were in the room when his pulse ox dropped?
It was.
What are you doing?
D still can't get a word though. Leave him to
Feeling better?
So much better. But I'll be back next year. Gotta defend my title.
See ya.
They got a Wiener World truck outside. You want one?
I think I'm gonna hot dogs for the rest of my life.
Yeah, I don't.
This is a 200 milligram MS cotton. This will give you 12 hours of relief. Me on my couch. I can't do this. I want to stay.
She doesn't want to go home. That's what it was. She don't want to put her
His
family
pulse
through
ox
it.
was steady. We were about to discharge him. Did Dr. Allycia put you up to that?
Hell has she me now.
I thought you didn't go the extra distance for your patients anymore.
What?
How's your first day going?
Good, I think. Haven't killed anyone yet. I'm sorry.
It's okay.
Yeah, no, that's a pretty good metric.
Yeah.
Well, when in doubt, stick with her, kid.
She scares me.
Evan?
I pay my respects. Besides, just gonna hold down the fort.
Remember the day you found a pet?
A little glance at Ogilvy there.
I know.
How many times did he say he was gonna quit drinking?
Oh, I said thank you.
I knew he was married.
That's Rhonda, Louie's wife.
Oh, he knew.
High school sweetheart. About 5 years ago, I was covering a night shift. He came in feeling talkative. Born and raised in Pittsburgh, lifelong Steelers fan, groundskeeper at Three Rivers Stadium until 1998.
Oh, that's cool.
He never really wanted kids. But Rhonda wore him down, and when she finally got pregnant, he changed his tune, he got excited. And then about a month before the baby was due, Rhonda and the baby were killed in a car crash.
I knew he was going to say that. I knew it. Well, no wonder he was drinking. Yeah.
Louie never really came back from that. May his memory be a blessing.
Is everything a blessing?
That was the end. All right. See you later.
I'm done. No. I quit. I think it was really cool how the new girl grabbed his hand, though.
I did not see that. I was trying not to watch.
Yeah. So there's some parallels to this in Scrubs.
Is there?
Well, I mean, we watched a very sad Scrubs episode. And then,
Yeah.
Yeah, but I mean, the Pit also brings elements of humor, maybe even more of like the real world humor, sarcasm, the dark humor that helps get us through these days, these really, really hard days in the hospital. I think this episode, maybe to me, I mean, I think they've done such a good job with this show through the first season and through the first, third of season 2. I think they've done such a good job telling the story of medical workers, healthcare workers, frontline workers, and they've done it through so many different angles. I think this episode, perhaps more than any other episode, has highlighted that as it kind of took us through the different angles of these healthcare workers, but showing all of the things that you are. I appreciate nurses more than anything, but I think like this episode highlights why. Because it was really, I mean, the nurses were the all-stars of this episode, clearly. And then even Dana, I don't know what she did, but yeah, I think it was what Dr. Al said, just because it's broken doesn't mean you don't keep trying.
Yeah.
So
then she messed with his pulse ox stuff.
She did something. I wrote down 5 bullet points, so bear with me here. I don't think these will take forever to talk about, but the episode was also about the legacy of Louie and the impact he had on the staff. And, working in a hospital, you don't always get, I mean, there are, quote, frequent flyers. The ER certainly, there's going to be patients that ER employees know very well, and Louie was one of them. On the inpatient side, there are also patients who you get to know. And I've mentioned before, part of what I love about outpatient primary care is this is what I deal with almost, this is every day, like dealing, like seeing patients and follow up and having years of a relationship built up with them. So I don't see them in maybe as sick of the state that you see them here, but that legacy lives on. I mean, there are patients that when they pass, when I have patients that pass, that it affects our entire office. That was cool that they paid a tribute there. We're going to go from something very thoughtful and sweet and really what medicine's all about to my second bullet point, which Ogilvy's a jerk.
That's what you wrote.
Yeah, I wrote Ogilvy's jerk. The callous and cavalier nature by which, I know he didn't know Louie. I knew this was his first week. So this was probably the first time seeing Louie. But just, like how he's yawning, like, yeah, he croaked. Like figures, alcoholic figures. I don't, there's something with him. I think what it highlights is you can be the smartest person in the room, but you can still be a shitty doctor. I've seen that. I've trained with senior staff attendings who fit that bill. They're smart. They're great technically, but they're terrible with patients. And so anyway, I don't want to call him doctor yet because I think he needs to earn that. But
Andy's not. He's a med student.
No, but I mean that more. And to me, that term means something. And so it's not just about how much you know. So anyway, we'll see. I mean, maybe we'll end up liking him. I keep saying that. I don't know. There's not a whole lot of redeemable.
I don't know what they're doing there.
There's not a whole lot of redeemable qualities there. But maybe they're showing that this exists in medicine. It actually does.
You mess with Louie too, so
yeah. Well,
pretty much dead to you now.
No, I mean all life matters.
I know. I didn't mean like really dead. I meant the term dead to me. Like I don't want to see you again.
I know. I wrote down coroner's case because I don't know if that term means anything to anybody, but if I have a patient that passes away at home, I get issued I have to fill out the death certificate. If they're my patient and they were not in a medical facility when they passed, they send these death certificates to me. Unless it's a coroner's case, and a coroner is involved if the situation surrounding their death is suspicious or has further questions. And so sometimes if you find somebody dead at home, that might obviously warrant additional questions. Sometimes they'll actually call the office, though, to see what kind of health status they were in, because a situation like this, Louie wasn't admitted into the hospital when he passed. He was in the ER.
Yeah.
They will typically contact the coroner. Somebody help me out here, because it's been a long time since I worked in the hospital. I feel like we would still have to contact the coroner's office, but I don't believe the cases like this were like cut and dry. I mean, Louie had chronic alcoholism, chronic liver disease. I mean, so there was no real index of suspicion for foul play.
Because the coroner's office probably has to take the body, right? Or
Well, no.
There's a morgue at the hospital.
Yeah, there's a morgue at the hospital.
Is there a cremation?
At the hospital? Not that I mean, I've only been to the morgue a few times at the hospital. So anyway, that's kind of what they mean by that. So like a coroner's case would be if, foul play suspected or further investigation was warranted. These kind of easy, I shouldn't say the word easy, but these kind of cut and dry, there was clearly no foul play involved. That does not require the coroner to say, quote, sign off on. But anyways, yeah, so that I wanted to maybe mention that because I don't know if people know that. And then kind of add a little levity to the discussion. You mentioned that we have a skeleton in our office that we dress up. That is true. That is very true. Mr. Bones is his name. My nurse, Carrie, buys clothes for Mr. Bones and will dress him up based on whatever season we're in. Right now he's got like a toboggan and...
A toboggan?
Yeah, toboggan. Okay. Well, he gets cold. He doesn't have flesh.
Like a beanie?
Yeah, and a beanie. And so here pretty soon we'll dress him up. We dress him up for holidays.
You don't have anything on for Valentine's
over Christmas? Day? Oh, you know what?
I don't think.
Yeah, we're gonna have to get him some Valentine's swag. But anyway, it's something kind of fun. Actually, a lot of patients love Mr. Bones. A lot of them ask about Mr. Bones, especially the children of the patients ask. That's when I usually make the joke that actually he was a former patient, but he was waiting for his peer-to-peer or his prior auth to go through. So never happened. So
do you always get a laugh?
Oh, always. Yeah, I kill with that joke. Dun-dun-dun.
Oh my God.
Anyway, last one I want to talk about. So this is kind of exciting to talk about because this is, again, bread and butter medicine. Really. Now, you said that in the Scrubs thing.
Oh, I know.
That won't land here.
It will land.
Yeah.
Every time he says bread and butter, because he says it all day long.
Yeah, well,
I'm going to bring out some bread and butter. So now it's just going to be this.
Some things are bread and butter medicine. So D-dimer, I don't know if you guys know what that is. So D-dimer is sort of a breakdown product of clots. If you're concerned about a blood clot, you can order a D-dimer. And if that D-dimer is negative, then that eliminates the risk of a blood clot. So it's a very useful test. If it's positive, now here is kind of the kicker though. A positive D-dimer does not guarantee a blood clot. And actually, there are a lot of conditions that can artificially raise a D-dimer. You have to take it with a grain of salt, but a positive test does usually warrant further explorations. What we do to rule out, say, pulmonary embolism would be to get what's called a CT angio of the chest, which that will show a blood clot. Or you can do what's called a duplex or B modes. These are Dopplers of the legs that look for blood clots. If you say, hey, I don't want to put somebody through radiation of a scan, I don't want to give them contrast if I can help it because maybe their kidneys are a little suspicious, then you order this D-dimer test. And if it's negative, then you don't have to worry about pursuing it. And then the nurse practitioner guy there, I can't remember his name, he made the comment, why bother? They're on Eliquis. So meaning they're already on a blood thinner. They're already on technically the treatment for that. And she's kind of saying he comes in every once a month. He just wants that reassurance, order the D-dimer. It's a pretty cheap test and it rules it out. But that's not to say you can have blood clots while on blood thinners. We would call that failure of therapy. Or let's say he's missed a dose or something. And because those what we call DOACs, direct oral anticoagulants, those like Eliquis, Xarelto, Pradax is kind of an older one. Those have such a short half-life that if you miss a dose, you're not protected. And so maybe they missed a dose. They don't have a whole lot of, say, food interactions like Coumadin. Most people are familiar with Coumadin. Coumadin is basically rat poison, like legitimately rat poison.
I didn't know that.
It thins the blood. And so in rats, it makes them bleed to death. In humans, it can also make you bleed to death if you take too much.
Yeah.
But Coumadin's tough because there's so much monitoring. You don't necessarily have to change your diet, but you have to be conscientious of what you're eating. And so if you have a large variety and it changes from week to week, that can actually really throw off your numbers. But anyway, you can fail blood thinner therapy, and that would be a problem. That would be a big problem if you did, but you can. It's not super common. But in a situation like that, you might throw or put what's called an IVC filter. So in fear of any cava filter, which is this kind of like metal kind of mesh almost device that you can affix to the inferior vena cava, which is the main vein that comes up that enters into the heart. If you put that filter in place, it would like basically catch a blood clot that keep it from coming to the heart, which would then keep it from coming to the lungs, which would then prevent a pulmonary embolism. Or if you have something called patent foramen ovale, or patent foramen ovale, that's a hole in the upper chambers of the heart. A blood clot could come up, enter the right side of the heart, shunt over to the left side of the heart, get pushed out in your aorta, and cause a stroke.
Okay.
This is medicine. Anyway, this is the stuff I love.
Well, that sounded bad.
Let me rephrase that. I'm not Dr. Ogilvy. I do not like when people have strokes.
Yes. Got a stroke patient.
But I do appreciate the science, and I do appreciate that we know how to help fix these things or prevent these things or at least reduce the risk of said things. You know, Dr. Robbie is actually, he's not all that different from Dr. Cox in Scrubs when you think about it. He doesn't have the sarcastic zingers, but he recognizes that what we do is merely temporizing. You can't outrun death. You can't escape it. The best you can hope is to delay it. And so I've enjoyed watching these two shows because there are parallels.
And at the same time.
The same time. All right. So anyway, really, really, really good episode of The Pitt. I hope some of you enjoyed that. I hope I didn't bore anybody with those details. But we really do appreciate this has been such a fun journey. We are enjoying doing this together, enjoying doing this with you. So we would love you to come back and check out another one with us. Before we go, anything else that you would like to add, Allie?
No. It's the first time you've called me Allie.
Well.
No, I got more than one name.
Yeah, but that's just short for...
I know.
It's just short for Allison.
You know that's not my name. That's a thing people used to call me. And I never correct them because I didn't really feel like I didn't want to talk to them. So
wow.
I was very antisocial, okay?
Were? All right. Anyway, thanks for checking this out with us. We'll see you guys next time. Have a good night.
See ya.
I am Dr. Todd.